Hello, this will be a presentation over the business plan proposal for the CHRISTUS St Michael's healthcare system. My name is Timothy Hawthorne and I'm going to be the Chief Operating Officer.
My name is Jennifer Cooper, and I served as our Chief Compliance Officer.
Hi, I'm Betty Shelby, and I served as the Chief Financial Officer.
Hello, my name is Caleb Hickson. I was the stakeholder advocate for our practice initiative. Thank you for joining in. Let's get this presentation going.
So, looking at the organizational description of this CHRISTUS St. Michael's healthcare system, you see that's a very large hospital that hits on all the different specialties, has very minimally invasive surgeries, has a high level of women's health and NICU coverage. It employs many employees in the area where it's located in Texarkana, Texas, including a high level of residents and being at the high level of Magnet and Joint Commission accredited. This specific hospital, CHRISTUS St. Michael's Health System, their mission is to extend the healing ministry of Jesus Christ. Their vision is to lead and advocate for innovative health and wellness solutions, and their values include dignity, integrity, excellence, stewardship, and compassion.
The SWOT analysis for CHRISTUS St. Michael Health System highlights several strengths, including its long-standing community roots and the opening of a new $17 million emergency center. At the same time, it identifies internal challenges such as limited telehealth capability and lack of mobile health services. Externally, opportunities exist to expand primary care, maternal health, and mental health services in underserved rural areas. However, rising healthcare costs and increasing competition from urgent care centers pose notable threats.
Our gap analysis revealed that residents of Cass County are disproportionately affected by significant health disparities compared to other communities in the CSM public service area. We identified three major areas of need: primary and preventive care, mental health services, and maternal and prenatal care. The findings listed on this slide clearly warrant a need for intervention that improves healthcare access and outcomes.
During the CSM Healthcare Stakeholder Assessment, we identified internal and external groups with varying levels of power and interest. High power, high interest stakeholders require ongoing involvement, while lower priority groups can be kept informed through general communication. Regardless of involvement level, all stakeholders are vital to organizational function and long-term sustainability.
The strategic issue facing the CHRISTUS St. Michael's business plan proposal includes the low ratio of primary care providers to residents in the rural community of Cass County, Texas, undermining its mission to extend the healing ministry of Jesus Christ. Seeing that Cass County faces a critical shortage of primary care providers, we see that it has caused limited access to health care, health disparities, and poor outcomes. So we propose to establish a nurse practitioner-led primary clinic in Linden, Texas. The goal is for it to be fully operational by December of 26, and the target is to serve 1,000 unique patients by December 31st of 2027. The strategy we'll utilize is through community partnerships, outreach, and expanded access to care. Our clinic's success will be measured through clear deliverables, KPIs, and metrics. We aim to serve 1,000 patients in the first year, achieve over 80% patient satisfaction, and improve blood pressure control in 50% of hypertensive patients. We will also ensure 60% of eligible patients are up to date on recommended vaccines and screen 95% of adults for tobacco use. Operationally, we plan to maintain 85% staff retention and reach positive financial margins by 2027.
Before opening the clinic, we must meet several federal, state, and organizational mandates that guide how we operate and maintain compliance, as seen on this slide. Collectively, these agencies establish the standards that ensure compliance, protect patient safety, support provider and staff competency, and allow the clinic to function within legal guidelines and receive financial reimbursement.
A force field analysis is part of organizational readiness to evaluate factors supporting or resisting change. Driving forces include rural provider shortages, supportive leadership, and CSM funding. Restraining forces include community misconceptions about APRNs, Texas scope regulations, and staffing limitations.
This table summarizes the 5 major risks we identified for opening the clinic. The biggest challenges are staffing, securing a supervising physician, and technology limitations related to broadband access, which all scored low in the current state. In contrast, funding and certification are more achievable because of available grants and existing resources. Overall, the average risk score can move from 1 in the current state to 2.4 in the desired state.
Our desired KPIs show strong potential, with an overall feasibility score of 2.6 compared to our current 1.4. While patient volume satisfaction and preventative care need significant growth, staffing, tobacco screening, and financial goals are highly attainable. These ratings guide where early efforts should be concentrated. Our Gantt timeline outlines a structured rollout from January 2026 through early 2027. The pre-implementation phase focuses on improving the business plan, securing funding, completing regulatory steps, and beginning construction and technology setup. Implementation begins in March with staff training, marketing, and our grand opening, followed by patient enrollment. Post-implementation runs through the end of 2026 and includes ongoing performance monitoring, quality review, and long-term staffing and sustainability planning. This timeline ensures an organized and efficient launch of the clinic.
The budget for the Cass County Medical Clinic covers all essential pre-implementation and implementation expenses needed to launch an APRN-led primary care practice. Key costs include facility space and overhead, furnishings, medical equipment, technology and infrastructure like the EHR system, licensure and insurance, and ongoing consumable supplies. In total, the project requires approximately $156,000 to implement.
Our primary funding will come from reimbursement for billable patient services. We identified several state and federal grant opportunities to help support provider recruitment, technology, workforce expansion, and enhanced service delivery. Local organizational support can offer financial support, networking, and community outreach partnerships. Together, these sources help ensure the clinic is sustainable and capable of meeting the community's needs. The amounts of each are detailed in our written proposal.
A cost-benefit analysis was conducted and showed that implementing the initiative would significantly improve rural primary care access, reduce emergency room strain, create local healthcare jobs, and decrease travel for patients. Not implementing the practice initiative would worsen provider shortages, increase burnout, and raise patient cost. Overall, the data clearly supports implementation with a benefit ratio of 1.61 compared to 0.5 if no action is taken.
Our process evaluation plan tracks every major task needed to open and operate the clinic while staying aligned with our KPI goals. This slide provides an example of some assigned tasks. Together, these processes ensure an on-time opening and achievement of key goals, including serving 1,000 patients in the first year. Details on this plan can be found in our written proposal.
A strong and structured outcome evaluation plan allows for consistent assessment of clinical outcomes, patient satisfaction, and overall program impact. The outcome evaluation plan will assess monthly clinical growth, income versus expenditure, patient satisfaction, and tobacco use. Quarterly assessments of blood pressure improvement will also be evaluated. Overall, this evaluation plan will hold the CSM Practice Initiative and its team accountable for growth and success.
Our business plan proposal for Cass County of a primary health clinic led by a nurse practitioner addresses critical primary care shortages. It aligns with the CHRISTUS St Michael's mission to extend the healing ministry of Jesus Christ and has a very strong cost-benefit analysis of 1.61 versus 0.5 compared to inaction. It also reduces ER burden, is very financially feasible, and is very sustainable, profitable, and supports holistic patient-centered care.
Thank you for your time and attention during our presentation. Our references and entire written proposal can be accessed by scanning the QR codes on this slide.